can't even speak. What kind of question is this? Right. Oh my god, they're both so unpleasant.
Hey guys, welcome back to the channel. My name is Kiran. I'm a junior doctor and a comedian working in Manchester. I recently did a collab video with nurse Zara. It's on her channel. You should definitely check it out. We compared the day in the life of a doctor compared to a nurse. In this video, we're doing part 2 of the collab. I'm playing Would You Rather with Zara. We did a little Instagram post recently to get your suggestions. Loads of them are medical, loads of them are weird, so let's get into it. As always, if you're new, make sure you're subscribed so you can join the team.
Okay. Would you rather stay in a room of C.Diff all day or clean deep oozing wounds all day? Oh gosh. Wounds. Because I'm more comfortable around wounds, and I know that might sound a bit strange, but working as a surgical nurse, I'm used to seeing different types of wounds, complex wounds, depending on the type of patient case it is, like trauma, orthopedics, general surgery. So I feel like that would be more tolerable than perhaps staying in a room where, you know, there's C.Diff. And if anyone has actually been in a room with C.Diff, it's not very pleasant.
Wounds. Both of those options sound absolutely terrible. C.Diff is a particular type of diarrhea. It's infected diarrhea with this bacteria called C.Diff, and it smells disgusting. You'll know if you've been in a room where C.Diff is around, you'll know. I wonder what Zara's gonna say though, because I bet she gets a lot of wounds doing what she does. The worst thing I've ever smelled as a doctor was this fungus that was growing in someone's crease. I'm not gonna say where it was, but honestly, that smell has stuck with me for the rest of my life. Would you rather date someone in healthcare or not in healthcare?
Healthcare.
That might sound a bit boring, but I have to say that because first of all, my fiance's a dentist, so she's in healthcare, but also because of the fact that we understand each other's schedules a bit more. So although there is a lot of healthcare talk around, she understands I have to do night shifts, I stay late at work, I have to work outside of working hours sometimes to catch up on stuff. And I think it's difficult for people not in healthcare to sometimes understand that sort of thing. And also it means that we have loads of gruesome stories to tell each other.
I say this with a bit of caution, of course, but I think naturally when you are with someone who understands your profession, works in a similar field, you just have something more relatable with each other. So I only see that as a positive thing. That's not to say that someone not working in healthcare won't understand your work, but I do believe it just creates just something more in common. Hence why I say healthcare. Would you rather work night shift or day shift? Day shift. This is without a doubt day shift. Like, I struggle so much with night shifts. I just don't think that my mind, my body is cut out for night shift life. So hands down, I will happily swap my night shifts for day shifts. It's as simple as that.
For me, it's because of the timings. So it might sound quite obvious, but night shifts, I find it really difficult to sleep on, and I find that I can't do anything else in that week. So when I'm on night shifts, I can't have any time to go to the gym, I don't have any time to write or film YouTube videos, I don't have time to cook properly. So mainly because of the time, I find it much better to work on the day shifts. The night shifts tend to be a lot quieter though. So if it was purely the time I'm at work, night shifts, I would say, are better because you're only doing the emergency things, and often in what we're doing, there's not as much going on at night. Would you rather wear scrubs to your wedding or your wedding dress / tux to work? Definitely tux to work. I'd be more than happy to wear a tux to work every single day. I love wearing a tux. If they decided that tuxes were the new uniforms for doctors, they decide to scrap the white coats, scrap the scrubs, from now on you have to wear a tux and be a happy man. Who doesn't feel great in a tux?
What? Wedding dress to work. I look at this in two ways. One, I think it would be absolutely hilarious to see like me rocking up to work in a desi lehenga and I'm tending to patients. I feel like that would just be hilarious to do. However, it's just for one day, right? And I don't think I could live with that thought of my one special day. Girls dream about their wedding days, and then your outfit is just scrubs. Like, I wear scrubs on a daily working basis, so I wouldn't want to be wearing the things I wear to work as a bride. So yeah, I think I'll go with wearing a wedding dress to work. Would you rather be vomited on or have a stoma explode? Vomited on.
Vomit, definitely.
Now, again, I think this is just because of my background of nursing. Bodily fluids do not faze me. So being vomited on, having a stoma explode, both of them, you know, it's happened to me. It's happened to me numerous times. So I would just say perhaps vomit. Now, the reason why I say this is because I've seen patients who've had their stoma bags burst, and it's a very unpleasant situation for the patient. And as the nurse, we try and just help in that situation, you know, comfort the patient. But I know whenever that situation has happened, I don't want my patients to go through that. Vomit, however, is something that we all can experience, and I feel like vomiting is generally just what everyone can go through. It's not specific to one patient group. I feel like it's not as unpleasant as having a stoma bag explode. So that is the reason for my answer. Like I said, I've had both situations happen to me, so if it happens again, then it happens. It is what it is.
So this is an option between the top end or the bottom end, basically. A stoma is an outpouching of bowel that will sit on the surface of someone's abdomen. So if they maybe have had some bowel removed, they'll have a little out pocket there, so actually the feces will collect there. So usually an ileostomy or a colostomy. So depending on where it is, the consistency is going to be different. An exploding stoma would basically just be poop going everywhere. A vomit is obviously vomit and smells vile, but if it's a choice between vomit and poop, I'm going vomit all day. Would you rather know how you will die or when you will die? When you will die. The reason for that is because if I find out how I was going to die, so let's say someone said I was going to die in a car crash, I would just then be terrified of ever getting into a car. Or if they said you're going to die in an aeroplane crash, I would never get in an aeroplane, so that would terrify me. I think if you knew when you were going to die, obviously it'd be sad because you know when you're going to die, but it means that you can plan your life and you can make sure you're doing all of your bucket list things before you die. So if they said you're going to die in 30 days, you'd maybe quit work and just do whatever you want, see your family, see your friends, that sort of thing. So I wouldn't really want to know either, but if I was going to choose, I'd rather know when I was going to die.
Oh gosh, that's a deep, dark question. I think how you will die. Living with that thought of when you will die just seems so daunting and scary as opposed to how you will die. Like, you could live to 80, fine. You could live in the next 10 years. That is certain, alright? Everyone is going to pass away one day. But I feel like knowing when that will happen is just this constant feeling, and I wouldn't want to know. I feel like you should live every single day to the fullest and enjoy and embrace life as it is. How you will die, I just think, is less daunting than knowing when. And who knows, you may die in a very pleasant way. Like, I think death is peaceful, and perhaps you can have a very peaceful death. You could be around your family, it could be a painless death. So, you know, perhaps knowing that information might not be such a bad thing. So yeah, I will say how you will die over knowing when you will die. Would you rather have to catheterize yourself every day or have 5 cannulas a day? What? Oh, I can't even speak. What kind of question is this? Right. Oh my god, they're both so unpleasant. I'm gonna say the catheter.
Catheter, definitely.
You know what, the catheter might actually work out to be something quite useful, because if I'm on a shift, right, and I can't go to pee because it's so busy, then, you know, you're already catheterized, so you don't have to worry about it. And 5 cannulas, like, I would be squeamish over 1 cannula, so I just can't imagine 5 cannulas a day. No thank you. Catheterize, we'll go with that.
I think catheters have some uses. So the catheter is a little tube that goes in through the urethra and sits inside the bladder, and that drains your urine. If you had a catheter in, that means you would never have to go and pass urine. So think of how much more productive your life would be. I feel like that's going to be the next Ali Abdaal video, making my life more productive by putting a catheter in. Cannulas hurt as well. I know we do a lot of them, but 5 cannulas a day, in a couple of weeks, you'd be running out of veins, and then it's going to get really, really difficult to put those cannulas in. The most difficult people to cannulate are the ones that have used veins a lot. Would you rather wear full PPE all day, every day, or not be able to wear any clothes for the rest of your life?
Full PPE.
I'm more of a warm person than a cold person. I like to be warm, and PPE does get unbelievably hot, but I can't even imagine going outside in winter not wearing anything at all. You'd just be locked inside your own house. Wearing full PPE wouldn't really be ideal either, but at least you're protected from literally everything. Think of what insulated, disease-free life you're gonna live if you do that. Also, if you didn't wear any clothes ever, how could you ever do anything serious? How could anyone take you seriously? You couldn't go for a job interview, you couldn't get married because you'd have to be nude, you couldn't actually go to work nude as well. How is a patient ever gonna take you seriously if you do that? So that's why I'm full PPE all the way.
Yeah. This one's a bit straightforward for me. I work in ICU, I work in a high-risk COVID environment. We wear PPE as if it's our normal uniform, and to be honest with you, I'm kind of used to it already, and I feel like that is more appropriate than wearing no clothes. So yeah, we'll go with full PPE on this one. Would you rather work with an inexperienced doctor who gets things wrong, or an arrogant doctor who always gets things right? I'm gonna say arrogant doctor. I don't think it's ever a good thing to be arrogant, regardless of your profession or in life. But I feel like an arrogant doctor who knows what they're doing and gets things right is safer for patient care, as opposed to inexperienced doctor who, you know, gets things wrong. Like, you can't afford to get things wrong, and what happens if you get something wrong and it ends up being something quite fatal? An arrogant doctor is something that I can deal with, and if he knows his stuff, then I'll always have respect in that way. So as long as they are not, you know, showering their arrogance everywhere, they know this stuff, then props to them.
That's a really difficult one. I would say arrogant doctor, because inexperience is absolutely fine and we all learn by making mistakes, but if you're always getting things wrong, I think for patient care and for patient safety, I'd rather have, even if I didn't get on with them very well, an arrogant doctor who is working well. If it was different, if it was an inexperienced doctor who was trying to learn and, you know, getting better, then definitely the inexperienced doctor all day. But if they're constantly getting things wrong, even after having learned things, then it has to be the doctor who's getting things right, I would say. But that's a difficult one too.
I think that's it. So I really enjoyed that. Thank you so much, Dr. Kiran, for having me and letting me partake in this Would You Rather game. I think it was a lot of fun. Definitely some interesting questions. Thank you so much for watching, guys. Take care and stay safe.
That was Would You Rather with Nurse Zara. Let us know what you thought in the comments, and as always, make sure you check out Zara's page and subscribe to both of our channels. Take care, everyone, and stay safe.